sitting and looking backwards instead of looking forward. So be very attentive and follow up what is happening here, because it's going to help you, and you will have your family members today and always. So please be very attentive. Don't always take people for granted. They have taken off time to come here and talk to you, and it's good that you pay them, give them your attention, because what they're doing here is not a joke. If it were a joke, they would not have come. And because we are here to learn, it's good that we should be very attentive, okay? So please be quiet so that we can start, and they can be very brief and go straight to the point. Nobody will have to liberate this hall, because the examination classes are supposed to continue writing. So we crave on your indulgence to be very quiet and cooperative. And if there's anything you don't understand, you ask questions. Please, we're not here in a market. You want to talk, put up your hand.
Thank you, Mom, Madam Vice Principal. Thank you, dear students. Permit me to present myself to you. I am Ning Elijah Ningamai, that's my name. And I am a teacher by profession. I teach English to Francophones and French to Anglophones. And I've been teaching for 15 years. And if we are here today to talk about cancer, it is not because we lack where to go to or what to do. It is because cancer is a killer disease, and the way it kills is more damaging than the diseases you know about. Thank you, the principal, for being present. You know about malaria, HIV/AIDS, tuberculosis. These diseases kill a lot, especially in Cameroon. But all the people who die every year from these three diseases, malaria, tuberculosis, HIV/AIDS, are not up to the people who are killed by cancer every year. It means if 1 million people die of malaria, 500,000 people die of HIV/AIDS, 200,000 people die of tuberculosis every year in Cameroon. More than 1,700,000 people die in Cameroon every year because of cancer. But we did not know it. So that is why we are here, so that you know it, and you start taking the necessary measures that will enable you to live a cancer-free life. Cancer is painful, it is costly. But there is another factor. In 2015, how many years from now? 4 years from now, 65% of cancer cases will be found in developing countries. 65%. But in developing countries, only 5% or less of the resources, when they say resources, they mean money, people who are trained in the domain of cancer, and infrastructure, hospitals that have the equipment. Only less than 5% of the resources to fight cancer will be found in those countries. It means that in Cameroon, for example, like Dr. Ashu yesterday said that if we screen girls in that class where we were presenting, at least one will have a sign of cervical cancer. It is not, we are not threatening you, but we are just telling you the bare facts. Cancer in Cameroon, you don't hear much about it on TV, on radio. So we are starting something so that you, as you are growing up, you will adopt the habits. The what? Habits. The lifestyle. The boy who smokes is more exposed to cancer than the boy who doesn't smoke. So it's a lifestyle. You have to start adopting the habits, the lifestyle, and the attitude. You have to be strong in your head, in your mind. You will be able to do those things, and at the end of it, you will go where you want to be. A cancer-free person who has succeeded in life.
And that's why we bring along medical doctors who are almost like me, because someone in that university staff saw the medical doctor who is accompanying us and when we created as doctor. I said, no, come and ask her what the problem is. She looks like you. And she's already a medical doctor. It means that you can have to plan for your life and focus on it and forget about those other things that come, those little things that come to disturb your plan, and you'll be where you want to be. So we are here to present the best time to have cancer, and the guest speaker is none other than this young lady who's sitting in front of us, and we'll present her. She's Dr. Ajok Stella. She worked with the Muea Provincial Hospital. She graduated from QS about 2 years ago. No QS. And she's like some of you. So, doctor, can we give us
they don't spread so fast, they don't grow rapidly, and they are not as deadly. But then what we are going to stay on mostly today is what we call malignant cancers. These are cancers which invade neighboring tissues, the blood, and the lymph with what I can call the speed of light. The cells divide so fast, they move through blood and lymph to find themselves in other parts of the body, and these are the most complicated kind of cancers. Here in Cameroon and in Africa, the most common cancers that we have will interest the cervix, like the most common cancer in women, especially in Africa. You have the breast, which is the second most common in women. Then you find lung cancers, which are also quite common around here. You also have what we call colorectal cancers. Those are cancers that affect the intestine, the terminal part of the intestines. And then you also have liver cancers. Also, there is prostate cancers for men who have the prostate exposition. Okay, it is important to know that anybody can suffer from cancers. Sometime in the past, cancers used to be termed as diseases of the old, because it was noticed that usually you will not find a patient developing cancers until a particular age. But more and more, we find cancers in very young people. So it's no longer a disease just for the old. Anybody can get the cancer. Remember that when you detect a cancer early, you can save a life. Because when it's already too late, there is no possibility of treating it when it has already spread to other parts of the body by blood, we can only do you supportive management. We manage your pain if you feel pains. If you bleed too much and you get anemia, we treat you for anemia, maybe by blood transfusion or some blood tonics, but eventually we will not be able to treat the cancer. It is also difficult to treat cancers, more so here because the cost is so high. And not only that, the centers where we treat cancers are not as many as in other parts of the world. For example, most cancer treatment centers in Cameroon will be found in Yaoundé and Ghana. That's already a practical problem for the Southwest because you need to displace yourself to get the treatment. And when you get there, the equipment are out of date. Sometimes we don't even have the material to manage the different kinds of cancers. But remember that prevention is better than cure. Anything that can be prevented in science, in health, we prefer to talk more about primary prevention. Because if you stay away from those things that will predispose you to the disease, then you save yourself so much from spending so much money, from staying away from work, you keep the economy high and so on. Yep. And then remember also that those who suffer from cancer say that it is like the most painful thing you can ever suffer from. Take a pain that is caused by an inflammation or an infection and see another patient who is suffering from cancer who has pains. Then you will know that it is quite important to prevent cancers. Alright, we're going to begin with cervical cancer for women, particularly, and for young girls, more so because of the risk factors which are involved in the getting of these cervical cancers. When abnormal cells are found at the level of the cervix, which is the opening into the uterus, then we talk about cervical cancers. This is the cervix. That small round thing with a small hole in the middle, but it's amazing that that is where you pass to come to earth. It can expand so wide. When the cervix gets affected with cancer, it looks something like that. And it is important to know that these things usually begin bit by bit. It starts by one small abnormality which you consider just so small for you, but then there is something going on which is really bad on the inside. This is how cervical cancer spread. Starting from the first diagram there, that's a normal cervix. Here you see some abnormal cells just at the entrance of the cervix. They are just beginning. That's early onset cancer. And then here you see the cells spreading upwards towards the uterine wall. And here they spread more, and even to the parametrium. These are the tissues surrounding the uterus. When they spread that much, depending on how much they are spread, we stage cancer in different stages. The more they spread, the worse the case scenario becomes. This is what we call genital warts. We find some small growths at the level of the female genital, at the level of the vagina. We find small outgrowths. We call them warts. They are caused by the HPV virus, human papilloma virus. It's a virus just like HIV. It's a very wicked virus in food. Because this warts will predispose you to cervical cancer. How do you get the female genital warts? They are sexually transmitted. So that is why we came with a message. We want to give you the most important message for cervical cancer. To say stay away from early onset sexual activities.
Repeat that again, madam, to them.
Sometimes you can stay without symptoms. The more reason why prevention is better than cure. Because you could keep it for quite a number of years, but you never know that you have any problem. But then you could have some abnormalities like you bleed abnormally. Every woman has a cycle. At this time you get to reproductive age, you bleed once every month. So you need to know your cycle well. Because if you bleed in between your menstrual periods, there could be a problem. If you bleed heavily, more than usual, there is a problem. For example, if you usually bleed and change 2 parts in a day, next month you change 4 to 5, you should really be able to know. Some people can bleed just for 2 days in a month, others will bleed for 3, others will bleed for 4, and even 5 sometimes could be normal. But that's why we say that from 2 angles. There are normal pains during menstruation, there are abnormal pains during menstruation. That's why we divide it in medicine. In medicine,
the boys, keep quiet. This it tells the girls. Keep quiet, let the girls.
In medicine, we call menstrual pain dysmenorrhea. And depending on the cause, it could either be primary or secondary. The primary usually is of what we call unknown cause. Usually, there are so many theories that have come up. They tell you that it's because of the secretion of prostaglandins in your system. I don't want to take you so much into that, but I just want you to know that there are abnormal pains and there are normal pains. For a young girl who is just starting her menstrual period and so on, you could start with pains from the onset. That is normal. It is what we call primary dysmenorrhea. That's why we give you these painkillers, which are antiprostaglandin to stop the pain, depending on the mechanism. But there are also menstrual pains that we call secondary. Secondary meaning that there is an underlying cause to it. Any sexually transmitted infection, any genital infection will cause secondary dysmenorrhea. If you have a problem at the level of your uterus, that there is an abnormal growth of cells within the uterus, what we call endometriosis, you can have abnormal menstrual pains. But it is just for you to see. If you started your menstruation with pains and it is continuing, usually those pains should end around your early menstrual period. It is normal. But if you did not have pains with the onset of your menses, some people are like that, and then later on you have those pains, and especially if you have other symptoms which favor an infection, like having a fever, like having excess vaginal discharge, like having vaginal itches, then you need to check that those menstrual pains could be abnormal. Then what other disease can smoking cause apart from lung cancers? We talked about cancer of the cervix, which is also favored by smoking. If you want other diseases, there is what we call aspergillosis. It's an infection caused by a fungus. A fungus, that is also something which can be caused by smoking. Just remember that smoking brings down your immune system, and whatever brings down your immune system exposes you to a lot of infections. So many lung infections are favored by smoking. After bathing, men usually feel like urinating again. Is it a sign of prostate cancer? Well, personally, I'm not so versed with such an experience as in after bathing, men will feel like urinating. But what I said is that if you urinate too often, you just went to urinate, you came back not long after, you feel like urinating again. Just a little comes out, you feel the urge again, you go so many times, that is called frequency. That could be a symptom of a urinary tract infection, it could be a symptom of prostate inflammation, it could be a symptom of prostate cancer. Somebody asked about the root of cancer, that we talked about the factors that favor them, the root of cancer. What you will notice with most cancers is that you will not find a particular cause that is tied down to a cancer. There are rare cause and effect relationships. Instead, what happens with cancers is that over time, unfortunately, it's quite expensive. It's not easy to come by. We have 2 main vaccines, Gardasil and celeBritys4africA. They are popular vaccines which are advised in the future for young girls who are not yet of reproductive age and who have not yet had sexual exposure, because then you are really sure that they don't even have the infection. Also, avoiding smoking is an important preventive measure, because smoking is a risk factor for the cervical cancer. Don't ask me why I was smoking for cervical cancer, because nowadays it seems to be modernism for women to smoke even more. Then talk about nutrition. If you eat a lot of fruits and vegetables, you will get vitamin C, E, and A, which are antioxidants and will prevent cancer of the cervix. Be aware for the women, be aware as young as you are that there is something like a cervical cancer, with the most common risk factor being HPV infection. So stay away from risky sexual behaviors. And then screening yourself. Usually it is advised that every young girl, at least after the first sexual exposure, should go for what we call a pap smear in the hospital. The pap smear, they simply take cells around your cervix and examine them under the microscope to be sure whether you have or not abnormal cells already growing there. Okay, these are all early onset, early tests to detect your cervical cancer.
Please, Dr. Ajong just said something here to the girls, but let me explain something. If you go down this road, from here to the end of the Muea market, just that small distance stretch of the road, you will see call boxes. You will see people struggling to sell groundnuts. People who are not up to 40 years of age. People whose parents gave them the opportunity, deprived themselves of so many things to pay their fees, buy their books. These people, what are they really doing there? The parents had a different plan for them. But these girls, because most of those doing call box are girls, you will see them along with children, 1, 2, 3 children. You might laugh, please. You might laugh, but that's the fact. And as a teacher, it hurts me to go along the road and see my students doing that. That's not why I taught that child. To see my junior sister, I deprive myself of a good shirt to buy and send to school doing that. But what is the cause? The cause of failure in life for 99% of girls is that word sexual intercourse. So long as you don't know it, please listen, you are in Form 4, right? What's your name? Linda, Rita. Linda is in Form 4. How old are you, Linda? Linda is 13 and in Form 4. A young girl, younger than Dr. Ajong, Dr. Mbuche Lovely, at 23, 24.
Let me shout to you.
She is a medical doctor in the Kumba hospital. And when she came to GTHS, as she was standing outside waiting for guys to get in, you know those boys, looking at their big boys, are very, they said, hey, Master, you find that so And when we presented that girl to the public as a medical doctor, they were ashamed. If you have a plan for your life, this sexual intercourse destroys 99% of our dreams. Why? Because the time you are supposed to spend thinking about the future, your life, you spend it thinking about the things that boy has done to you. You spend the time thinking about those phone calls that you have to make to go and spend some time at the Charger Hotel. What will you change in your life? It will destroy your life. And when you start having sexual intercourse, please, let me name you 5 things that will happen to you. Number 1, you are exposed to sexually transmissible diseases. Why so? Because it has been proven that condoms cannot protect you. It has been proven that that boy, that man who is calling you and telling you that he loves you so much more than his mother, should be having at least 3 or 4 other girls whom he's saying the same thing and doing the same thing with them, and that's why you are not sure. Trust these days is no more possible when it comes to your health. It's your life. Then number 2, apart from that sexually transmissible diseases, number 2, and the most damaging one is that you will bring home a child. It is expensive. Look at them. Please, I'm saying what I have lived through. My family members have lived through that. My junior sister lived through that. My friends in the quarter lived through it. It hurts to see your sister, to see your child coming home. 13, 14, please, the third thing is that it distracts you. You understand? Leader, it distracts you. Listen, you don't focus again on the plan for your life. You focus now more on things that are just not useful. If we limit ourselves just to those 3 things, if we limit ourselves just to those 3 damaging aspects about starting a relationship, before getting married or before attaining your objective, right? We'll come back to one question. Dr. Ajo, who is speaking to you, do you feel happy, proud of her? Yes! If she started such activities, and she graduated from peace at 24, please. At 24 years of age.
My age mates are from 4.
Yeah. In the vice principal's office, there were a boy and a girl standing there in Mr. Ndumbe's office. And when I presented her as Dr. Ajo, I was, I'm a teacher, I know your reactions, right? I was observing them, and they were nothing. And I said, no, please come, if you have any question, ask her. The girl said that I'm really surprised that she is a medical doctor. I said, ask her whether it's fake. Because she's like me. Please, those things distract us and we focus on that. And for you, please, for you to avoid that, very simple. Get a plan for yourself and repeat every day. My plan. Repeat every day in your mind as you are going along, right? My plan. What's my plan? I will be the medical doctor. I will be the medical doctor. And to all those things, when that boy comes to you and tells you that you are the apple of my eye. Tell the boy that is just part of my. When they call you and tell you, please, let's go to. Because even though we roasted fish and soya and a drink and 2,000 grams, tell the person that that's not part of my. Call me, please. Tell the person, call me 5 years from now. 5 years from now, Linda, who is in Form 4, should be at least having a first of having in the university. Call me 5 years from now, we'll go for the fish. Is it okay? Yes. If you have started, please don't feel ashamed. It's difficult to stop. But if you have started, fight and stop it because that is not part of your plan. Is it okay? Yes. Thank you very much.
got you, boys and men. We are getting there. Yes. So we want to talk about breast cancer. Breast cancer is the abnormal growth, just like we said for cervical cancer, abnormal growth of cells at the level of the breast. And breast cancer used to be common from about 50 years of age, but recently we have noticed that even from 18 years and below, we have young girls who present breast cancer. So it is not an abstract topic. How do you know that you have a breast cancer? Any abnormality, any abnormal condition. Okay, I see that it's really distracting. But this is as far as we have known. Breast cancer. But remember that this lesion did not begin in a day. And the funny thing about Cameroon is that this patient might have been seen this day for the first time. It's just to tell you that know your system, know your body. If you face the least change in your body, ask another person who knows better than you for that if there isn't a problem. It starts bit by abnormal sensations. Sometimes you just feel pains around your breast. Sometimes you just notice a color change, a skin color change around your breast. Sometimes you just notice that your breast is abnormally larger than the other one. I use abnormally because it's not a rule that both of your breasts will have the same size. You could have a little difference between the two. But know yourself, check your breast at least once every month so that when there is a problem you will know. Also, you can find a lump at the level of your breast when you feel it. You can find an abnormal discharge or liquid coming out from your breast, usually tinted with blood. That is a sign of breast cancer. You can find a particular skin change which is associated with breast cancer is what we call orange skin. That's a part of your breast just develops some small pores. You know an orange, not so? There are some small holes on the orange skin. So if your breast develops that kind of pattern, then it could be the herald of a breast cancer. As early as 18 years old, it's important to perform a self-breast exam. I'm going to show you how to do a self-breast exam. And between 18 and 39 years old, added to your self-breast exam that you do every month, we advise that you get a clinician or a doctor check your breast at least once a year. If you are above 38 years of age, and especially if you have a history of breast cancer in your family, a first-degree relative like a sister, a mother, an aunt, a grandmother, then you need to have what we call a baseline mammogram. A mammogram is an X-ray that is specific to the breast. It looks at your breast tissues, and when there is an abnormality, it will be able to tell you in time. Between 40 and 49, depending on your previous findings, it's good to have a mammogram at least once a year. And then greater than 50 years, if you have a family history of breast cancers, perform regular breast exams and do a mammogram every year. When you examine your breast, be able to tell whether or not there is an abnormality. If you think there's a problem, then check a doctor for a second opinion. Maintain a healthy weight that will keep you away from breast cancer. Stay away from alcohol as much as possible. Do regular exercise, not necessarily very hard tasks. Even walking on foot a little bit faster than the regular walk, 30 to 45 minutes a day, 3 to 4 times a week, is good exercise enough to keep you healthy. Stop smoking, reduce alcohol consumption considerably. These are the different postures you can take to examine your breast yourself or get a second party to examine your breast. You could stand with your arms sideways, like standing like this. You could raise both of your arms. You could put one of your arms behind your head to tense the muscles around the breast on the affected side. When you want to come to this side, to use the other hand. Then this hand will help you to examine. If you want to lie down while doing the examination, you put a pillow below your shoulder to raise that up. Then you put one hand behind your head to examine one side. After that, you put the other hand to examine the other side. How do you examine? If you stand in any of these postures, stand before a mirror, you do an inspection. Generally, globally, the the both breasts should look globally the same. If there is a difference, like size-wise, a very marked difference, skin color change or anything, you will see it yourself through the mirror. After that, you move to what we call the variation. Divide your breast into 4 parts like me. First, you draw a line passing through the nipple, which is the middle, going down. Then you draw another line sideways. Then you start. If you feel, you notice if there is a pain or there is a mass or a lump inside, which is not supposed to be the case. At the end of that, after going through the 4 parts, following the division, you press your breast as if you want to express milk from it. Normally, for somebody who is not breastfeeding and who doesn't have a problem, there should be no flow from your breast. But if there is a flow, and especially if it is tinted with blood, it may be a sign of blood cancer. Breast cancer. Alright, so that is for breast cancer. Even you globally what it is, you can perform your breast exam, like I said, once every month. For those who menstruate, for those who are menstruating already, you can say 1 week after your menstrual period, you set a date when you examine it. The next month you do the same thing. If you are not yet menstruating or you are no longer menstruating, you can set a fixed date every month. You can say the 1st of every month I will examine my breast. The 1st of January you do it, 1st of February, 1st of March. Most of those calories are not so good, not only for cancer, but even other diseases. Diabetes, hypertension, metabolism, all of those are not calorie present. So we use the amount of carbohydrates that is safer, use the amount of fats that is more. Simply those are the benefits. Now, increase, watch your calcium intake. We have noticed that more and more around here, everybody gets himself on calcium. It's become a very common practice. When you feel things, which percent doesn't know it's calcium. But what we are saying is that sometimes low calcium, blood calcium can cause those pains, but it's not the only cause of such pains. So be sure that you have a low calcium. You can check your calcium level in your lab to be sure that it's low for you to take calcium. Just because of calcium is not also. Eat more fish, because you can notice that fish has some oil that they call omega-3, which is very protects you from prostate cancer. And avoid the other fatty acids which are found especially in margarine. Eat a lot of fruits, especially potatoes. Take a lot of vegetables in your daily meals. Avoid smoking. In fact, I would say stop smoking. Because smoking is one of those habits that we need to stop having. The hazards of smoking are increasing by the day. Avoid overstimulation with vitamins. I'm not sure that we need to so often with multivitamins. Try yourself multivitamins because you are weak. You are not weak. You are not have a diet and you just go to the next pharmacy and get multivitamins for yourself. You notice that in black men, overconsumption of this mega vitamins causes them prostate cancer. Try to stay away from stress. Stress is still an factor which predisposes to cancer. Take home message. If you are both 40 or you have a relation to both 40, then go yearly for what we call PSA. It's a prostate-specific antigen produced by the prostate gland. So this is the marker that we use to test for prostate cancer. Do it yearly when there is a problem, you will notice it earlier. Remember that there are other conditions which might present just by prostate cancer, but you cannot stop the symptoms. That is anxiety and inflammation, co-management of the prostate. There is what we call benign prostate hypertrophy. That is even more common. The prostate gland enlarges, but it is not cancer-linked. That one has the better prognosis, it can better be managed. Can we go to long counting? I have they are not very one of them has 3 lobes, the other one has 2 lobes. So it's quite big. So for a cancer to spread through 1 lobe or through 1 lung, and not for you to start having symptoms, you might have taken years of years. So for this, that's the picture of the very big long tumor. Let me move on to causes of risk factors for cancer. Like I said, smoking. That's why I said I'll talk only about smoking, and that will be the end of lung cancer. Over 90% of lung cancers come from active smoking. Active smoking means that you do the smoking yourself. You light up the cigarette, you light up the pipe, or what do they call the other one? There is cigarette, there is pipe, I don't know, my German or there is also what we call passive smoking. Passive smoking means that you don't smoke yourself, but you are exposed to cigarette smoke, maybe by somebody so close to you who smokes. You should also be able to stay away from passive smoking, Because even if the percentage is lower than tobacco smoking, also gives you lung cancer. Beware of peer pressure. Your friends think that they can smoke and you don't want them to smoke, be able to take the responsibility to stay away from those friends. Be able to take the responsibility to stay away from environments which will cause you to do things that you don't want to do, including smoking. Also, you have family predisposition. If you have a family history of lung cancer, you are more exposed to it. If you have a history of other lung diseases, like infections caused by histoplasma, that can also predispose to lung cancer. There is also air pollution, which is not so common here because we don't have a lot of industrial pollution here, but in towns like Rwanda and other...
Gentlemen, are you Fabrice on your uniform? Discriminating against anybody, but just we came here not only to talk about cancer, but to inspire you to have a plan.
This one is not even well dressed.
Fabrice, what's her name? Pardon? Fabrice, because he is, I was behind there and although I was small in school, I used to be a backbencher. He's a typical backbencher, and at times, listen please, at times some of us teachers are frustrated because we don't understand backbenchers. Fabrice, I want to give you a responsibility. That 5 years from now, whoever is making that comment, please, he should be honest enough to give me his or her contact number. I'll give him mine. Then 5 years from now, we'll verify where he or she will be. Please have a plan. Fabrice, whatever problems you are facing in life, you have the right to plan. What do you want to become, Fabrice? Please, say it louder, people will hear. What do you want to become? Talk louder, Fabrice. Again, Fabrice wants to become a medical doctor. Can we clap for him? What do you want to become? Linda wants to become a journalist. Give her a clap. At that age, she should have become a journalist at the age of 24, maximum 25, right? And not any kind of cache journalist. You understand? Okay, a real journalist. So please, we thank you, and these are our ambassadors amongst you in this school.
Contains particles that are cancerous and they are not good for the lungs. Smoking cessation, whether it is active or passive, as described the tool for you, is the most important way you can prevent the development of lung cancer. There are studies that have shown that if you stop smoking, if you smoke more, but the more sticks or the more packets you smoke per day and over the years, the more you are exposed to lung cancer. the longer the length of time for which you have been smoking, the more you are exposed to lung cancer. But the good news is once you stop, as the years go by, your risk for lung cancer decreases. So much so that by 15 years after your last episode of smoking, your risk is down to 0. It's just like somebody who has never smoked before. So if you are smoking, do your best to stop so that within the next couple of years, you will spare yourself the risk of lung cancer. So healthy habits and lifestyle, stop smoking, eat healthy, do regular exercise, maintain a healthy weight. Obesity is also a risk factor for cancer. Stay away from early sexual relationships, monogamy as your choice, and then avoid or limit how much alcohol you take. Cancer is very costly to treat. Cancer is deadly for the most part because we diagnose them very late here in Africa. Cancer is so painful a disease. So remember that prevention is better than cure.
I'll take your indulgence to give a personal testimony of what happened to me 26 years ago when I was 13 years old and in Form 3. I had friends in Form 3 who were not my friends, please, because it's later on in life that I discovered that my friends are the people who take me towards my dream. They are not the people who take me away from my dream. I had friends who used to come. I was a child. I would just sit. I would used to have 100, 200 francs. Since my parents used to send me money, they would come and say, please give me 100 francs, give me 25 francs. And in those days, it was much money. But they would come and buy cigarettes and they are smoking, and I would be there looking like a fool. And after about 3 months, I asked them, because they never gave back the money they took from me. I asked them, what are you people smoking like that? He said, take and taste. I took it, please. No, don't laugh at it. It's what happens 99% of the time when you see all these thousands of people who go around. It's what happens. You, 99% of the time is your friend, your classmate, your partner friend, your neighbor who does that to you. And what happened that why do we feel pain during our menstrual sex? Another question is not about the example. Good, apart from cancer of the lung, what other disease can be caused by smoking of cigarettes? That question, yes?
For boys, at times when
please, yes?
mostly after when you feel as
good for boys, but after mating, you feel like you urinate again after just urinating. Is it a kind of prostate cancer? That's question, yes?
Since the Cameroon government knows that tobacco is making the cause of lung cancer, why should they promote it by taking high tax? Taking high tax will become the
good. This young man has asked a wonderful question. What's her name? Bishop. Marvin, come forward. Good. Last question. Yes, lady? Gentleman. Yes?
Just talking about where cancer is being found in the human system. What about the root of it? Where does it come from before it gets into?
Okay, the root of cancer. Where does it come from, right? Where does cancer come from? Okay, listen. While Dr. prepares, I will answer Bishop's question. Please, listen. Bishop has asked that why does the government still keep on taking money from those companies to prevent, instead of just stopping the production of cigarettes as it's dangerous. Please, always remember that apart from your father, you are the person who is directly concerned by this issue. Your father has his reasons for behaving towards you the way he is behaving. If you want to question your father's behavior, you might forget that it is your life that you are going to live 10 years, 20 years from now, when maybe your father will no more be alive. Start doing something to improve on yourself while your father is still taking the decision to improve on your life. Because government also has difficulties in banning cigarette production. If they ban it, then those boys grow their own behind and start selling illegally. You understand? It means government will lose the taxes, will lose the opportunity to even tell you the smoker that.
Yeah, that's the question. Government authorizes the cigarette company to come and install in Cameroon in order to do what? One, create employment. Now, to create employment, you understand me? And not only to create employment, to get taxes, just like you said, to be able to sponsor one or two things. The government does not ask you to smoke. The company is there, government has its reason. They want money. They want to get people employed. But they have not asked you to smoke. And that is why, that is why behind every cigarette packet, it is written there cigarette smoking is dangerous.